Hey, be careful. Okay. We're gonna say this. Hi, Shayna. Let me first say that I am so happy for you. I know that you and Charlie will make yourselves into wonderful parents. Just remember to stick together, support each other, tell each other that tell the other one that what a good parent they are, and be compassionate because everyone is tired and some deal with it better than others. So I have put together a list of my top 10 hints for getting through childbirth and those first weeks. Please remember to consult your doctor or midwife if you have any questions. They will probably give you a totally different answer. Alright, so number one. In my opinion, labor is 40% physical and 60% mental and emotional. Most of which is the belief in yourself to be able to do it, really. Your body was designed specifically for this purpose, so, your physical is kind of taken care of. And you know what? This has happened, like 116 billion times to Homo sapiens before, since 50,000 BC, so, if they can do it, you can do it. Two, remember, when I say your body is designed to do this, what I'm talking about is specifically the pain aspect. It is pain with a purpose. A year after the fact, I don't even perceive it as a painful experience, and I gave birth in front of my couch with my with only my labor-induced mind trip as a pain reliever. My midwife told me to go where the pain is. So, in other words, progress labor faster by having the most intense contractions you can have. If you're like me and you want a short labor, that's by far the best. For instance, when I sat down, my contractions stopped. When I laid on my side, they were super intense, so I laid on my side. Obviously, survival of mom and babe is paramount. The survival of you and Fox is by far the most important thing. But there are also a lot of unacceptable outcomes besides just me and my baby survived. There you go. Yeah, good girl. The trick is to figure out beforehand what they are, and if it's a laundry list, you need to whittle it down to 2 or 3 and use that belief muscle, the belief in yourself, to make it happen. Mine were not having a C-section and having a short labor, and I was successful in that, partially because I believed I could and partially because physically my body was okay with it. If something happens and you do need an emergency C-section, of course that is an acceptable outcome and it falls into the me and my baby survived category. 4, afterwards, everything is going to hurt. Everything. But that is normal, but it gets better every day. Just remember, don't get up for a couple days, or better yet, do like the Eastern, they do in the Eastern world, and don't get up for 40 days. Just hang out with your baby, sleep, eat a ton, and take showers, because they'll make you feel a lot better. 5, do you have a lot of thongs and not many granny panties? Well, now is the time for granny panties and maxi pads, because you will probably have, you will have your period, or as they also call it, lochia, for anywhere from 2 to 6 weeks afterwards. Let's call it nature's way of making you catch up for 9 months of no cycle. Also, my midwife told me to not get always brand maxi pads because they can hinder healing. I don't know why, but... Yeah? What do you have to say about that? Okay. Day 3 is called wet day. The first reason is because your milk usually comes in, which means that it feels like you have 2 tender grenades that have now suddenly been attached to your chest. Remember, prior to this, you were producing only colostrum, which is really thick, and so you don't really have anything. But when your milk comes in, you may leak everywhere all the time for a couple of weeks. It maybe took 3 months, I have to say, to not soak shirts through because I didn't wear a nursing bra to sleep. With nursing pads. And I think when I leaked, I actually leaked for like 6 months at times on just one side. That's why this one's called Leaky, because Leaky liked to leak every time I let down, even when I wasn't with Lyra. So the second reason the third day is called the wet day is because your hormones drop out the bottom of the world and you may cry a lot, wet tears. That is fine. Let it flow. You did something amazing and your life is transitioning dramatically, so have a good cry to celebrate. Whoa! 7 is when your hormones drop out the bottom around day 3 postpartum. This usually leads to the baby blues and occasionally anxiety. Baby blues is 10 times baby blues oftentimes lets up after a week or so, but sometimes it progresses to PPD, which is postpartum depression. But really, anxiety can be hard to avoid because, let's face it, our developed country does very little to support new parents, apart from kicking them out of the hospital with a list of don'ts and a mind full of unanswered what-ifs. So here is a mini list within a list to help you deal with the inevitable anxiety that descends when you need to keep a helpless person alive after doing the most physically rigorous thing in your life. Okay, 1, sleep. Sleep, 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 sleep. Whether it is when your baby sleeps or whenever you can, just try to sleep. Lack of sleep is almost always cited when someone has a hard time mentally after having a baby. Let's be honest, that child will sleep a lot in the beginning, so you should have many opportunities if you just let yourself relax. Hi. Really? Okay. 2, if you're having trouble sleeping, try sleeping skin to skin with your baby. Do it with supervision so that you don't, if you're worried about any sort of thing. It helps regulate your hormones and you know that your baby is fine, which also really helps. 3, watch only positive things. I've said this to you before and I will say it again. You'll have a lot of time sitting on your couch or in your bed when you're nursing and recovering, so only watch funny. That is an order. And along those same lines, don't read the internet every time you have a question, especially when you are hormonally vulnerable, as I like to call it. I know that you love to know things, but it can be crazy making sometimes in the beginning. Just wait a little while or let someone else read it and just get the most information. 5, if you don't have house care, like if no one's going to be in the house that you know, like a relative at some point in the first month, get a postpartum doula. They do your dishes, they look after your baby so you can shower, and they provide company and support when you really, really need it. Alright, so that's the end of the mini list. Back onto the regular list. Okay. Number 8, your body knows how to gestate and give birth, but I am not so convinced that it knows how to lactate without good advice and tutelage. But remember that there is very little that gentian violet, some lanolin, and a great lactation consultant, mostly a great lactation consultant, can't fix. When I say great, I mean great. Get advice from others and references from others about lactation consultants that are hands-on, have years of experience and high accreditation, believe in you, and are calm in all storms. It will help so much. My amazing lactation consultant, Anne-Marie Neely, got me through the following. Endless thrush, 3 cases of mastitis, abscess surgery, a tongue-tied baby, DMUR, which stands for dysphoric milk ejection reflex, undersupply, oversupply, painful letdown, that thing where your nipples lose blood and are temperature sensitive. It's like Fraser syndrome, I can't remember. 6 months of a nipple shield, and you know what? I am still feeding my child with no problems 13 months later. So it took a while to get there, but definitely worth it, and only because I had a really great lactation consultant. This is a side for Charlie, even though my child has a noisemaker. Okay, so as a daddy tip, we're going to say the number 1 reason that women stop breastfeeding, or they stop breastfeeding, they end breastfeeding prematurely, is because they don't have support from their partner. So when Shayna sits down to nurse, automatically do the following. 1, provide a pillow, a boppy or otherwise. I saw a picture of you getting a boppy. You have to get comfortable because you will be there for a while, most likely, because the baby will fall asleep and you don't want to wake it up. There's like a million different things, and if your like arm is hanging up in the air or you like have something uncomfortable, like it'll never work. The other thing, give her a very large glass of water because it is the most, like, it like sucks the water out of your mouth. Nursing does. 3, feed. That's a good time when your baby's eating for you to eat as well. If you can manage with one hand, I used to do it all the time. All right, and then also hand a good book or tablet, and hand it. Like, don't put it like over here or over here, because if you're nursing on this side, your left hand's not available. If you're nursing on this side, and then like I would always be in a situation where I would start nursing and I would finally get latched and everything would be fine, and then my book would be over here, and I couldn't do that without totally messing everything up. Okay, number 9, away from daddy thing. Number 9, sleeping. This can be a touchy subject because we're told so many things about SIDS and infant suffocation or whatever, that the reasonable and common practices of many cultures are ignored, and you are left with no way to sleep sanely. Trust me, like if you were to listen to what they say, they're like, you can do this and you can't do this, you can do this. It's like back is best. Yes, back is best, but so is side. But they never say that because they're trying to blanket, they're trying to give you nuggets of information without realizing that there is some give room. Yeah, you don't want your baby to sleep on its front, but side. Lyra never slept on her back. She hated sleeping on her back. She always slept on her side. All babies are different. Okay, so some people co-sleep. Some people put their beds in cribs in the same room, which is technically co-sleeping, or cribs in another room, or inside side sleeper bassinets in their room, which is what I did. I personally actually shared a bed with her first, so I could sleep skin to skin, because I just didn't really sleep at all for a while, but we slept skin to skin. And then I put her in a co-sleeper bassinet for the beginning of the night and brought her into bed when she was big enough to side lie and nurse. If you're a heavy sleeper or afraid, then don't bed share. That's fine. But if you are interested, there's a lot of information about how to do it safely. These includes not being under the influence of drugs or sleeping pills or anything, doing fancy blanket things, right? Because you don't want to pull the blankets up over you and over your baby's head, and lying in a certain way, which basically includes like putting your arm up here. I'm a pro at this now. It took me a long time. Like putting something behind your back to support it until it gets strong enough, and then putting your legs like this, and then you put your baby here, and there's absolutely no way that you can ever roll over your child. But I only say that because it was by far the best thing for helping me get sleep, especially sideline nursing, because they nurse and you're like this, you guys both go to sleep together. It's just like this dandy little oxytocin dream. Okay, so the most important thing to remember is never ever fall asleep with your baby on a couch or an easy chair if you can help it. Because what's happened is that people are afraid to fall asleep with their babies in bed, and then they're going to a couch and accidentally having a problem there. It's much more risky than bed, so don't do it, either of you. For me, bed sharing worked because I made it work. I'm a much better person when I had sleep, and I only barely had to rouse to nurse her in the middle of the night. Okay, so here's a short list. You almost got the harmonica, right? Blow. Blow. Anyway, here's a short list of must-haves to have in the house when you get home, just in case. 1, food. Lots of food. Have a friend set up a meal train. Store stuff in the freezer. Do whatever. You need to eat a lot, and you're not going to want to cook, and neither is Charlie. You know, order takeout. Do whatever. Whatever you're planning on doing, make it so that you basically have to do nothing in order to have food. And lots of it. For like 6 weeks would be great. But that's, yeah. I think we kind of had help like that. So 2, lanolin. Lanolin is the, there are other versions of it. You can use coconut oil or whatever, but it helps prevent cracked nipples, and it helps just soothe your nipples when you're nursing. 3, polysporin in case you have cracked nipples. That's different than neosporin, obviously. Polysporin is has more something. It doesn't have antifungal, but you can get a prescription for that if you feel that fungus is a problem. 4, a stool softener. You might not need it, but you might need it because everyone talks about the notorious first poop. Yeah, that's what that's for. 5, ibuprofen. You can keep having it, and it's a great thing to have, especially in those first couple days. Number 6, a maxi pad soaked with witch hazel, and you put them in the freezer. And I told you about this. It is total bliss in your underwear, because what it does is if you have hemorrhoids or if you have any of these other things that have magically appeared within the 2 or 3 days in which you gave birth, then it will just swell. It reduces the swelling, and the cold is awesome. Number 7 is granny panties, which I already mentioned. 8, breast pads. It's good to have reusable ones that you can wash, but it's also really good to just have a massive big box. My mother-in-law gave me a massive big box of disposable breast pads, and it was great because I had thrush, which the yeast would travel between shirts and all this kind of stuff, and the disposable nursing pads helped a lot. And maxi pads, not always brand. Yes? You want to come over here? Are you okay? 10, pump. I would say a pump or nipple shield in case you have trouble feeding in the hospital. If you already have your pump, it's really good. Come on over here. My midwife gave me a nipple shield, which like saved my life, and I needed a pump because she wasn't good at eating, so I had to pump, you know, in those first 2 or 3 weeks. I just was exclusively pumping so that she could eat. Come here. Come see mommy. Come see mommy. It's okay. An early sitz bath, which you get a sitz bath in the hospital, but it's nice to have another one at home. Mother's milk tea and oatmeal to both help increase your milk supply. Those first 2 weeks are the key. It's when you like set down all your lactation mammary glands. So it's really important to try and produce as much as you can. And number 10, the last point. They call it the longest, shortest time for a reason. Every day can feel like 10. Every day is capitalized with a D, capital D. Day 1, day 2, day 3. That stops eventually. But you will get through it, and some days will be harder, and some days will be easier, and there will always be regressions and progressions, but it will quickly get totally awesome and rewarding. Yes? Because it only takes 6 weeks until they start to smile at you. Okay, well I hope that these tips will help you get through this amazing transition. Never forget you are a wonderful and capable and fantastic woman, and you can do this. I totally believe in you. From Lyra and I, peace out. Can you say bye-bye? Can you say bye-bye to the camera? Say bye-bye. Can you say bye-bye? Say bye-bye. Bye-bye, camera. Bye-bye. Are you not going to say bye? You're an expert bye-byer. Yes.